for you. For example, if you have pain down the front, that's usually a higher, like L2, 3 area, which is lumbar spine 2 or 3. If you have pain more in the back down here, then it's more L4, 5, S1. Sorry, I said that really fast, didn't I? Anyway, so your lower vertebral spine. So let me show you a couple of pictures so you have more of an idea. So in this picture, you'll see the sciatic nerve is actually the blue thing down here, and it breaks off into smaller nerves down the leg, but it's a pretty big nerve, okay? However, it is protected in the buttocks area by a lot of soft tissue, muscles, fascia, etc. So in this case, there are nerve roots up here that are coming from, it looks like L4, 5, and S1, for example, and it goes down the leg here, okay? And then people can get pain all the way down to the foot. So your typical sciatica pain is below the knee. And in this picture, it shows where there's a blebbing out of the disc, so a bulging disc pushing on a nerve root and irritating that nerve root, causing pain signals to go down the leg. On an MRI, which you could see on the side of the body, you'll actually see a little blebbing out of the disc that's pushing on potentially the spinal cord. You know, that's another area where people get pain. So in this picture here, this is something different. This is called piriformis syndrome. And instead of the nerve being irritated at the level of the spine, the nerve is actually irritated at the level of the butt. There is a muscle that goes across from the sacrum to the greater trochanter of your femur called the piriformis muscle. Here's another picture of it. So if you're looking at the back, okay, I know it's hard to tell, are you going back or front? But we're looking at the back of the person. This muscle goes from the sacrum to the leg. Okay, and this is a muscle down in the butt. Now there's other muscles that are around it, gluteus medius and maximus, and so sometimes you're like, well, how do I know which muscle it is? Your physical therapist probably will tell you which one it is. When they push on it, it'll hurt, or it'll be really, really tight as compared to the other side. So as you can see, the nerve roots can go, the nerve roots pass through the piriformis muscle. So if that's really tight, or the fascia is really tight around that, then you can get pain down the leg as well. Okay, so how do we patch for this? Well, our pain relief patches are called Ice Wave. These are the phototherapy patches that has a tan and a white. So this is Ice Wave. So they are divided in 2 different locations, the front and back pocket. So just make sure whenever you're using Ice Wave, you use both a white and a tan, because it doesn't work otherwise if you don't use both. Okay, so I'm going to take 1 tan and 1 white out. We're going to show you the simple sciatica protocol. And what I often tell people is make sure you drink at least 16 ounces of water before you do any pain relief patching, because you want the system to be well hydrated in order for these signals, to be able to flow through the body. In Chinese medicine, any pain is caused by blockage, energy blockages. So you want to be hydrated so that the energy can flow through these blockages, unblock those meridians and those channels, and then the pain will be relieved. So for the demonstration, and also you can do this on your own as well, is on the back of each patch, put a curl of tape. I've got a little curl of it's just Scotch tape. And I like to put it on 1/2 of the backing here so I can take it off easier now after I'm done with them. So I'm going to put a curl of tape on each of the Ice Wave. So I've got the tan here and I've got the white here. Okay. Now, the typical sciatica pain protocol is you put the tan over the area of the spine. And normally, if you have pain all the way down to the back of the leg, that's going to be lower spine. So you're going to put it, I know this is huge, but you're going to put it an inch or 2 above the, the sacrum. Okay. So the tan's going to go there. And depending on which foot it is, we'll say for the purposes of demonstration, this is the left foot. Okay. So if the pain goes down the left foot, what you're going to do with the white patch is you're going to put the white patch on top of that foot. All right, so I know it's huge again. And you're like, well, where, Dr. Karen, am I going to put it? Well, liver 3 is a good spot. That's between the big toe and the second toe. Okay, but somewhere on top of the foot. And here's the thing is, when you're hydrated, and if this starts working for you, it's going to start working very, very quickly within 10 to 15 seconds. So if you are 9 out of 10 and now you're 5 out of 10, that's really good. But we want more than 50% decrease in pain, ideally, at least with the pain patches. So what you can do if you get some pain relief but not all, is you can start playing with it. So for example, for this one, as you can see in this other picture that we showed earlier, wait, this one here, yeah, you see how this branches out? Okay, so it goes to the frontish, backish area. So what you can do is tweak it. So you can put the white patch a little bit maybe to the outside ankle and see if that makes the pain relief better. Or you can put it more on the inside ankle, you know, to see if the pain relief is better. Or you can move it slightly up the leg to see if it's better, right? You can even, if you want to, move it to, you know, the back of the affected calf, right? So you can play with these, and that's why we put tape on, so you can see after 10 to 15 seconds in each position whether it's better or worse, and you will know right away whether it's better or worse, okay? Now, if you're like, I don't feel anything, like I don't feel better, it could be a couple of reasons. One is hydration, of course, we talked about. The second is that it's possible that your nervous system is not really on track. It's out of balance. So you may be locked into fight or flight, which is stress response, or a freeze response, and you're not in a balanced autonomic nervous system state. So your nervous system is not balanced. You're either too stressed or locked in. So in that case, we would add, this is a more complex protocol, we would add in the LifeWave Eon patches, okay, which is a broad spectrum anti-inflammatory and helps to balance the nervous system. So it does two things: decrease stress and decrease inflammation. Of course, with pain, we often have inflammation. Now, in this case, what I'm going to have you do is you can keep your patches on the sciatica protocol, so tan on the back, white on the foot. Okay, I'll just put it back on this left foot here, right here. Okay, and what you're going to do with this patch is you're going to put it behind the right ear. So right back here. Okay, so behind the right ear, there's a hairless spot. People call it triple burner 17. Sorry, this keeps flickering in and out. There we go. So on the back. So what this does is it helps to balance the nervous system very, very quickly. The other points you can put, of course, are in the middle of the forehead, which most people don't want to walk around all day with. Well, maybe you do if you're selling them. Or front of the chest. Okay, so you could put any of these are a brain balancing point. You could also put it on, which is really handy actually, the back of the neck. And the nice thing about putting it in the back of the neck and having the tan one here is that you're also shooting energy between these two patches and not just these two patches, right? So this might be a good one to also try. Again, wait about 10 to 15 seconds, make sure you're hydrated, see if there's a difference. If there's a difference, then you know, aha, I needed to brain balance, okay? Now, what if you get worse? What if you put the tan on here, you put the white down there, and it gets worse, the pain gets worse? In that case, all you got to do is you just switch the colors. Yes. So instead of tan on the back, you would put the white on the back, and then you would put the tan on the foot instead. So you're reversing the polarity on the patches. So that's how you know. And even if you're not sure, like, should I put the tan on the pain or should I put white on the pain? Chinese principles are like, if the person has had a long time, like years, you know, with this issue, oftentimes the white may work better here because it brings more energy to this old area. Whereas acute, meaning recent, within the, say, 3 weeks to maybe 3 months, something fairly recent, there's still a lot of inflammation here. So sometimes the tan, or most of the time, the tan will do better on this spot. Okay. So play around with these. It's very safe to do so. So what else can we do? Well, if it's piriformis syndrome, okay, and you don't have a herniated disc, okay, but you still got pain down the leg, we'll go on this side. What you can do is put the tan right over the piriformis. Yep. You can just go online and just look for locations of piriformis, and oftentimes if you poke that area, you'll notice one side's a lot tighter than the other. A great way to test it is to take a tennis ball and to lie on it over that butt area, and then see both sides, and see how that is. Now, tennis balls are fairly squishy. You're not going to like damage anything, but certainly if it makes the symptoms worse, as you go over that piriformis, first of all, you find the piriformis, and second of all, you're like, okay, that's where it is. So that's where you would put your patch. So again, you can put the tan. I would start with the tan first, white on the foot, or if that's worse, or you want to try it out, you can put the white on here and then the tan on the foot. And of course, you can have the brain balancing one up here as well. Now, some of you may be saying, well, gee, Dr. Karen, you've got IceWave, you've got Eon. What about the X39? What about this patch? This patch is really important, stem cell enhancement, right? So we want to regenerate parts of our bodies. Don't we want that? And the answer is yes, we do. Yes, we do. It's not necessarily symptom relief. Not everybody gets pain relief right away with the X39s. If you do, yay, awesome. You just put it where the pain is. It's gone. Awesome, right? You're done. It's not even, you don't even need a protocol. But if you have this pain down the leg, you've got your Eon for brain balancing, that's optional, and then you've got the ones on your back and the foot. Then how the X39 would work is I would suggest that you put the X39, either double patch it on top of the tan one, okay? So we'll go back to our sciatica pain caused by herniated discs and things like that. So you can actually double patch it right over top the tan, or my favorite is to put it on the belly, like in the brochure, right below the belly button. Why? Because you're shooting energy right into the pelvis, right into the back. And a lot of spinal issues may be caused by leaky gut and other gut imbalances. And we know that the X39 helps to heal the gut, or the GHK copper peptide that the X39 stimulates helps to heal the gut very quickly. So I'm a big fan of putting it on the gut. And so now you've got the most complex protocol that we're going to cover today is you have the Eon on the back of the neck or behind the right ear. You've got your tan patch over the area where the sciatic nerve is being pinched or irritated, either here or in the piriformis. And then you've got your white patch on the IceWave on the top of the foot or wherever it feels better. And then lastly, if you wish, you have an X39 2-finger widths below the belly button on CV6. Okay, it doesn't really need to be exact, but somewhere down here, okay, to help heal the gut and support that whole pelvis torso area. Yeah, so try this out. Let me know how it works. Please,